Hi, my name is Agnes Czuchlewski, and I am a patient advocate with the physicians at Lenox Hill Hospital in New York City. And I am a patient champion for WomenHeart, which is the National Coalition of Women with Heart Disease. And it's an interesting organization in that to be part of it, you have to actually have a history of heart disease. So, one of the things that I think is interesting about my history is how it came about. On December 28th, 2015, I had a heart attack. I was 61 at that time and had a long, long history, grandfather, mother, grandmother, history of coronary heart disease, diabetes, high blood pressure, and high cholesterol as well. But I never thought of myself as being impacted by these. I thought I was too young. I thought I was too healthy, too active. So, when matter of fact, I'm of the generation that I wasn't even tested for my cholesterol until I was over 35. And at that point, 240 was considered just a little high, but normal. So getting back to the heart attack, I was in New York City with my whole extended family. We were at New York Historical Society, walking around the museum. And prior to getting to the museum, I was having a pain in my heart or pain in my chest. I walked around for an hour and the pain was getting worse. And at that point, I started thinking, gee, maybe there's something to this. I should get it checked out. But I'm with my whole family. It's right after Christmas. This is a whole big trip out. And I didn't want to ruin it for everybody by just all of a sudden me and my husband leaving. So we stayed for about an hour, and then it was like, no, this is too bad. Went into the ladies' room, put a little cold water on my face because I was sweating. Took an aspirin because I heard that was good for your heart. Unfortunately, it was a time-released aspirin, so it didn't really do very much good. But when I came out of the ladies' room, I said to my husband, let's leave. And he thought we were going to go home. When we got downstairs, we got a cab. And we got into the cab, and I said, let's go to Lenox Hill Hospital, which was cross town, but relatively close. And my husband looked at me saying, I thought we were going home. I said, no, I don't want to wait. My body is telling me something important, and I need to have it checked out. And that is definitely one of my big, big mottos is that follow your body. Know your body. If your body is telling you something that's unusual, listen to it. I walked into the emergency room from the cab and was told by a not so nice person that, well, you're well enough to walk in so you can wait. But at this point, I was having really bad pains in my chest. I was kind of bent over, hugging my ski jacket. And I finally said, listen, I am not waiting any longer. I think I'm having a heart attack, which is the first time I said that. And I need to be seen immediately. And I started walking through the doors to the emergency room bays. And the woman at the desk, that was the first time she actually got up and said, no, you can't go in there. And I said, yes, I can. I need to be seen. And at that point, that was the other thing I've learned is advocate for yourself. Don't be dismissed. If you are not getting what you need, be persistent. So when I went in and they started taking care of me. And long story short, I ended up with one stent. So I came in on the afternoon of the 28th. They put the stent in the morning of the 29th, and I was home by the 30th in time for New Year's. And it gave me a whole new life. From that point, I kept bugging my cardiologist. Well, what's going to happen next? Well, when can I expect another heart attack? I saw some terrible statistics about 25% of people dying after a heart attack. And I started getting myself really kind of worked up with that. And that's where my next theory came from, is that you have to test what you're doing, what you're saying. Is this really true for you? Is this something that is going to impact you? So my cardiologist, who I just do a shout out to Dr. Rachel Bond, who also spoke at the conference, she gave me the best advice ever. She said, go live your life. And it really kind of set me back by saying, listen, yes, this thing has happened. Your life has changed. Things are different, but you still have a life to live. And one of the things that came out of it was actually Dr. Bond recommended me attending one of the WomenHeart meetings. And ultimately, I ended up going for training at the Mayo Clinic and leading the group that I was attending as their champion. So what comes with bad things is also a lot of good things. And I feel like I have a new purpose for my life after this heart attack. And so this was a good story to tell. Obviously, there's a lot of things that play into this: weight loss, getting my cholesterol down, getting my blood pressure under control. And you can't just sit back and be complacent about it, but you do have to work it into what your new life is.